my pleasure now to introduce the two ladies who were the winners of the inaugural Cancer Services Award for Excellence in the Provision of Cancer Services, which was awarded last year. Victoria Jones is the Psycho-Oncology Service Development Social Worker and Project Officer in the Aboriginal Health and Cancer Services Working Together project within the Murrumbidgee and Southern New South Wales local health districts, and Alison Simpson is the team leader of Aboriginal Health for Murrumbidgee local health district. And they're going to be talking to us today about their project, Aboriginal Health and Cancer Services Working Together. So please welcome Victoria and Alison to the stage. Thanks. Pointer. Is it a pointer? Yes, that one there. The top one.
Thank you. Okay. Thank you very much indeed, and thank you very much for the opportunity to talk with you today. We're actually going to, our talk is entitled More Than Just Talk, Our Commitment to Improving Access to Cancer Services for Aboriginal and Torres Strait Islander People. And there are several layers to that title. First, talk is really important. But talk needs to happen at another level as well. And that is a really profound way of building relationships, and also about being silent and listening. We also need to engage in more than just talk, we need to act. And so we have a great commitment to action. But action really can only come profitably when we've done the talking. So I just want you to think about, if you will, some of those layers of talking and action. And part of that importance of talking and action is next to acknowledge people.
We'd like to acknowledge the traditional owners of the land in which we are meeting today and pay our respects to elders past and present. As an Aboriginal person, I'd also like to acknowledge Aboriginal and Torres Strait Islander people who are in the room today.
We'd also like to acknowledge all the Aboriginal and non-Aboriginal health workers and community members engaged in this Working Together project. It is absolutely without question that without an enormous number of people that this project would not be successful. And there are a couple of those people in this room today. I'd also like to acknowledge the Cancer Institute and Cancer Australia, and particularly Penny Adams, who has been enormously supportive to us in the project over several years. So what we're going to talk about is the background to the project, the rural context in which we work, the principles of the project, because they are absolutely fundamental to the way we work, the importance of yarning and relationship building, our commitment to action, and some of the challenges that we face. So back in 2007, I was in my other role as a social work team leader in oncology social work. I was at a cancer meeting of the local cancer services, and we had one consumer rep, and I said at some point, do you think we should have a consumer rep for Aboriginal people? And one of the clinicians in the room said to me, but Victoria, I don't have any Aboriginal patients. Now this person didn't say, therefore, why would we have a rep? But that was how I understood what the question was being raised. And for me, the question was not, why would we have an Aboriginal representative in the room, but why don't we have Aboriginal patients when we know that the outcomes for Aboriginal people are so poor in relation to non-Aboriginal people, and that the cancer rates are pretty much the same. In our area, we also have slightly higher numbers of Aboriginal people than the national average, and we certainly have pockets in which we have a very high Aboriginal population. So to the credit of that group of people, they said to me, go away and see what you can find out and see what we can do. It took me 6 months to find someone in Aboriginal health who was really interested in this, and she and I together, Lee Simpson, put in an application. She was the manager of Aboriginal Health for an innovations grant, and that's where it all started. And I really want to pay credit to her because she was very clear about what we needed to do. So the aim of the project, which is in several phases, which began in 2008, is to improve access to and utilisation of cancer services by Aboriginal and Torres Strait Islander people. This is just an indication of the area in which we work. It was former Greater Southern Area Health Service, which is now Murrumbidgee and Southern New South Wales local health districts. It's an area bigger than Italy, and we have a population of around 480,000, so it's a rural regional area. And I'm going to talk to you about some of the outreach that we've been doing and just show you where those places are. So in Griffith, in Narrandera, in Wagga Wagga, in Albury, in Goulburn, and in the Murrumbidgee area on the south coast, and there is a community here called Wallaga Lake that we're going to talk about. So the objectives of our project were to consult first and foremost with Aboriginal communities and with Aboriginal medical services. We have subsequently mapped the whole area in terms of where the Aboriginal populations of people are and where the cancer services are. We then developed a number of outreach sites, which I've just pointed out to you, which is about taking cancer services, in as much as they can be taken, out to community. About training for Aboriginal health workers and Aboriginal people around cancer awareness so that they can speak with much greater confidence in their own community about cancer and the services. And cross-cultural awareness training for non-Aboriginal workers so that we create places of safety and cultural respect within our cancer services. And then the importance of education for community around why it is important, why it makes a difference that if people are diagnosed early and see their treatment through, why that makes a difference, why that's important. And then again, another aspect of education in the community is something that we've developed more recently, which is specifically around men's and women's business. So the principles that I want to talk about, and I want to give you an example for each of them. They're fairly general principles that we would all see as important often in many situations. But the way that we've really tried to see these through in the project, I think, is important. So when we talk about valuing and building respectful, equal working relationships, one of the things that I'd like to talk about is the training that we now do in cultural awareness training. So, for example, in going to Griffith, we have worked over probably about 8 months with the Aboriginal Medical Service and with the Lands Council and with cancer services there, with myself and with a social work lecturer from the Australian Catholic University to create the cultural awareness training that happened there. The cultural awareness training involves presentations from a local Aboriginal person about culture and history. And then we talk about white privilege, which is something that we feel is really important, that we recognise the privilege that we hold as white people in society and the impact that that has on the way services are provided and the way we relate to each other. And then we do a shared role play. So that is a joint input by Aboriginal and non-Aboriginal people, and then we have the opportunity to talk about that in a real-life cancer situation. Driven from the bottom up. When we went to Narrandera to consult with the community there, we had arranged to go. I went with the Aboriginal health team leader, and we always do everything Aboriginal and non-Aboriginal together. And the community there told me that they didn't like the way that we had come and that we wanted to consult with them. They were happy to be consulted, but they wanted to do it in their way. So they said, you need to come back in a few weeks' time when we've organised a community meeting. So that's what we did, and we came back, and it was great. And we heard what they wanted to say, and we were able to get the kind of information that was important for us. They also said to us, will you come back? And Alison will talk about that in a while. When we look at community control and genuinely sharing community control, when we did the final report for the project, the first phase of which finished in 2010, before that report went to the Cancer Institute, the executive summary went to everybody in the communities amongst the staff who had been involved in the project to ask what they might want to contribute or any queries or concerns they had about what was written. And in fact, there were some things that were sent back. People could get the whole report if they wanted to, but that was something like 70 pages, so we didn't send that out to everybody unless they asked for it, which they could do. But Albury, for example, where we'd consulted there, said, we don't want a report sent out through the post. We want you to come and talk to us about it. So I did. And we talked through the report, and at the end of that, they said, spot on. So that was really good feedback for us. When we talk about being sustainable, one of the things I think it's really important for us to do in talking about building capacity is actually recognising the capacity that already exists. I think it's very easy to think that projects are about building capacity. I think they're about recognising existing capacity and then building on that in ways that are respectful, and that's what we've tried to do. In the training that we've done, again, when I think of Griffith, one of the things that it was really important for us to do was to build relationships because they didn't know us. And you can't assume that the relationships between Aboriginal organisations in an area or with the health services are comfortable or productive. They may be brilliant, and they are in some places. But when we go in, we've got to be very sensitive to all of that. And one of the things we've really tried to do is to listen to the tough stuff. So if people want to challenge us or people want to say what has been happening in health services or in the community, then we need to listen to that and not be defensive and start building the relationships around how we might really produce some really useful training that is of value to people. And in Griffith, the feedback we got from the training was people were absolutely stunned to hear local Aboriginal history, because there were people in that community, non-Aboriginal people, who'd lived there all their lives, and they had no idea the impact of things that they were sort of vaguely aware of, what the impact that had on Aboriginal people, and has today.
Yarning and relationship building to achieve change. Why is it so important? Relationship building for Aboriginal communities is fundamental for doing anything in their communities. The unfortunate reality of Australian history and the impacts of previous government policies and also the history of racism and discrimination within Aboriginal people have caused a lot of them to be very non-trusting of non-Aboriginal people and mainstream services. So that's why, even as an Aboriginal person going into a different Aboriginal community that wasn't my own, building those relationships were absolutely crucial. Letting them know that we were going to come back. A lot of communities that we've worked with basically said, you know, we've been researched more than the dinosaurs. People come in, they research us, they go out, they say they're going to come back, they're going to, you know, do A, B and C, but we never see or hear them again. And one of the things that was asked was, will you be coming back? And that was a huge part of this project, to make sure that we did what we say we were going to do, and we were very consistent with that. Even at times when we thought, when different things were happening in different communities, that you know, it might be best to stay away from the community. The fact that we said that we'd be there at this day and this time, we didn't want to break that, so we went back and done that. As an Aboriginal person, again, it's not as easy to work in communities where you're not from. So that also takes time and trust building, relationship building as well. Cancer is a death sentence for most Aboriginal people. In Aboriginal health, as soon as you mention the word cancer, they automatically assume that it's a death sentence, so they don't like to talk about it much. They don't want to hear about it. This project has helped raise awareness in these Aboriginal communities about the fact that it isn't a death sentence, that there are treatment options and all of that kind of stuff, and just raising awareness there with those communities. I think it's also important to understand and acknowledge the history, the culture, social context and diversity within Aboriginal communities and localities. Aboriginal people need to trust again, and that's not going to happen at 1 visit, 3 visits, 5 visits, but rather an ongoing, long visits. As Michael mentioned this morning, Aboriginal people hold a unique position not only within this country but within the world. being the oldest continuing living culture within the world, that often has been ignored. Understanding and acknowledging these things will help develop and strengthen relationships, which will in turn enhance service delivery. And I think as people build relationships and have a better understanding of these things, it decreases the fear that some non-Aboriginal people have with communicating with Aboriginal people. And this was just a map that we thought we should chuck in, which describes Aboriginal Australia as it currently is. We've got one people, one continent, however different customs for each. And although many may be similar, it shouldn't be assumed that what works well in one community will automatically work well in another community, because that's not the case, and it certainly wasn't the case with this project either.
So I'd like to just talk briefly about the notion of being an outsider. For Aboriginal and Torres Strait Islander people, cancer services may well seem like a foreign land. We know that cancer services are set up in a way that is absolutely designed to try and produce the best service, the best outcomes, the best treatment for people, given what we know about what is successful treatment. But if you come from a culture where relationships are most important, your relationships with your family and with your community and your responsibilities around that, and unlike in many white Western societies where individual health is so prized, in fact, your main meaning for life is around relationship, then having to be somewhere at a particular time of day, every day for 5 weeks for radiotherapy is very difficult when you have things happening for which you have responsibilities in your community. And I think one of the things we need to do, and which will really help, is if we can try and work out what is the flexibility. Of course you can't compromise treatment, but what is the flexibility that we can create, and the understanding both ways of why it's important. I'd also like to briefly talk about the influence of whiteness. I, in this project, have been constantly challenged to reflect on my own identity, my own white way of doing things. There's nothing wrong with having a white way of doing things. It's the only way I can do things. But I need to understand what the impact of that is. So one of the things that I need to learn about is going with the flow. And that's really what I have needed to do, and to learn and to be confident about and trust that things will happen. And they do, but they may happen a very different way from the way I thought they were going to happen. I said to someone recently, some of this work I do, it feels like it's absolutely chaotic. And she said to me, then you know you're doing the right thing, because if it's all orderly, you're not being culturally respectful. Now, chaotic is my white word around that. It's not chaotic. It's about a different system and a different way of doing things that we have to recognise and not see as chaotic. So part of our commitment to action is we just want to give you some illustrations about that linkage of talk and action.
As Victoria mentioned earlier, we done some work at Wallaga Lake Koori Village, which is on the far south coast of New South Wales. Was quite a tricky community to work with, and also as an Aboriginal person working within that community. However, through persistency and that consistency, what I was talking about earlier, we started to form and build and strengthen relationships with the local Aboriginal elders and communities there. And the project started to take place and work really well. The community took ownership and drove the way in which we done things. We also, the Aboriginal health workers there worked alongside the mainstream cancer services, doing role plays, showing them typical Aboriginal case scenarios, which I think helped them within their practice also. And to this day, the cancer care coordinator and the social worker are still going on to that Koori village, providing services, education and awareness for the community, which isn't necessarily with an Aboriginal health worker. So they've been able to link in with that community through the work of this project.
So I want to talk now about Out in the Open, which is going to be taking place on Tuesday next week. This is in Narrandera, and back just before Christmas when we were talking about how we were going to take things forward, the idea came up of having a day in the park around Aboriginal women's health and cancer. It's taken us from then till next Tuesday to organise this, but I want to emphasise those suggestions would not have come up, and the Aboriginal community members would not have, well, it was they who actually suggested it. This would not have been embraced if we hadn't been going there for the 3 years that we have been going, because that really says something about building relationships. So our organising committee, that's a picture of them, comprises people from the Medicare local, from the Aboriginal Medical Service, from the Cancer Council, from the Narrandera Shire Council. We have local businesses involved. We have the foundation involved. We have experienced the most enormous community goodwill around all of this. That's just a very small number of the organising committee. When I counted up the number of people who will be acknowledged for their input next Tuesday, it'll be 35 people, and that probably doesn't count everybody. And local businesses just want to support it as well. And the general message has been, this is really important stuff. So what we're going to do on that day, it's a day in the park, and we're praying for fine weather because that's Narrandera Park, and we've got tents coming, and we've had to learn how all the health and safety things around putting up tents and so on, and all the rest of it. We're going to have a series of sessions which will cover things like early diagnosis of cancer, caring well for yourself, breast awareness, coping with cancer, some practical support. So there'll be a series of sessions that will happen during the day for the Aboriginal women. And so whatever happens on Tuesday, and if the weather is appalling, although it's looking quite good at the moment, then that will change the numbers of people who come. If there's a death in the community, we know that out of respect, our numbers will be significantly decreased, if indeed, I don't know whether anyone might come. But what we say to ourselves is, this is a success already, because the relationships that have been built up in that community and awareness of cancer is just so strong that other things will happen as a result. Men's business. When we consulted with communities several years ago, one of the things they said to us that they were more concerned about anything else was the health of their Aboriginal men. So we took that seriously in the second phase of the project, which is currently, and brought together a group of male Aboriginal health workers. There's someone in this room who I know will know exactly what I'm saying. We have never had so much fun in all our lives, because working with a group of men, I can tell you, is very different from working with a group of women, and it is absolutely hilarious, but also it's very serious. They have decided, and it is totally led by the Aboriginal men, that they want to do a DVD for Aboriginal men about the importance of early diagnosis. And they have a phrase, which you may see sometime soon if you see any of the Aboriginal sporting teams around the knockout and so on, which is early screening keeps you dreaming. So this is just one of the locations that the DVD will be shot at. We're in a partnership with Charles Sturt University with their media unit, and a fantastic person there who is so supportive of the project. This is just some men yarning about what's important about early diagnosis, and again down by the river. Challenges. Huge challenge about sustainability, which I know everybody understands. But one of the things we've tried to do is embed everything that we do in with the local services, and to hope that therefore, and provide support for them to continue this work. But it really does need support from management and every level of the service. And in fact, we went to the Senior Managers Forum in Murrumbidgee just recently, which had 80 members of hospital general managers and so on across Murrumbidgee there, to talk with them about the importance of this being supported at all levels of the organisation. We need to embed respectful processes. That respectful processes are not something, I believe, that one learns through cultural awareness training only. That's important, but it's about building relationships so that when we're really stuck, we can say to somebody, like I can say to Alison, I don't understand what is happening here. Please tell me what I need to understand. And that, for me, is the learning, the really important learning and respectful process. And lastly, from what I'm going to say, is we need to beware in all our goodwill, in all our good intentions, because there is a lot of goodwill out there, I think, of people who do want to make a difference in Aboriginal health outcomes, that we don't perpetuate colonising initiatives. And by that I mean, for example, if you're building a new facility, do you include Aboriginal people right at the beginning? Or are they thought about somewhere down the track or later? If we really want to make health services culturally safe for people, we need to be involving them right at the beginning in a genuine partnership. And I think that's a really big challenge for us, because health services are so busy. And I know there's a lot more consultation that does go on, but I think it's a real challenge for us.
I just wanted to speak about the artwork that was done for this project by an artist named Stuart James from Narrandera. In the middle is the kangaroo, which is the nationally recognised symbol, and an animal that covers the areas in which we've worked. Up the top you'll see a white meeting place.
Oh, sorry.
That's okay. The white meeting place, which represents cancer services, and down the bottom corner there's an Aboriginal meeting place, which represents Aboriginal communities. You can see the feet going from the Aboriginal communities up to the white services or the cancer services, and also the feet with the white dots in it, which represents the white community coming down into the Aboriginal community as well. The line through the middle represents cancer and how that fractures communities, both Aboriginal and non-Aboriginal. And then in the corners, we've got some dots there that represents Aboriginal culture opening up. So I think the artwork really represents this project in a really good way.
Thank you very much indeed.
So, do we have any questions? Yes, would you like to just come up to the microphone, please? Thanks.
Thanks very much, Victoria and Alison. It's a fantastic talk and really informative, and obviously I'm very interested in this area. You talked about sustainability, and of course by nature projects tend to have discrete start and finish times, and they're funded accordingly. And thank you for talking to us about how you've embedded sustainability, or how I guess the strategies you do that by. Can you talk about some of the successes you have had in terms of sustaining your good work moving forward?
Well, I can think of something very recently, and there's someone in this audience who was actually present, so I'm hoping my interpretation of it is the same as yours. We met in Albury. Albury's one of the outreach... not Albury, Wagga Wagga. We met in Wagga Wagga. We have ongoing outreach meetings. They happen very differently in each area, but in Wagga they've continued every 3 months. And it's where Aboriginal workers and non-Aboriginal cancer services workers come together just to yarn together and to try and think about new projects, be involved in NAIDOC Week, go to local Aboriginal meeting places and so on, and talk with them about cancer. But one of the things that happened at that last meeting was, for me, the most fantastic conversation that took place between the cancer care coordinator, someone from the Aboriginal Medical Service and a local elder, and the other people in the room, which included myself, breast care nurse and clinical trials people, around how do we really get to make our services more approachable and comfortable for Aboriginal people. And what eventuated was a discussion around, would it be appropriate for the cancer care coordinator, the social worker and the breast care nurse to come to the Aboriginal Medical Service on a regular basis and just be there to talk and meet with people. And out of that, that they might suggest that they get together with a group of people who've had treatment, just around a cup of coffee or whatever, supported by the AMS, to talk about what worked, what didn't, what do we need to learn, what do we need to understand, and how do we get the message out into the Aboriginal community about cancer, and so that it doesn't feel Obviously, sometimes it is a death sentence, but on the whole, it doesn't have to be. So that's just an example. So I think it's about people. It's providing a situation where the clinicians and the community workers can all come together and do what they can do. But you have to build those relationships first.
So we'll I'm sorry, I will have to close the session because of the concurrent sessions that will follow. So please join me in thanking Alison and